welcome to Health Live at Seniors today. As many of you who have come here in the past are aware, we've had several orthopedic specialists on our Health Live sessions, but we've never discussed a very critical issue of ankle and feet. And when we were speaking to our friends at the Reliance, which is the better known in the past as the Krishna Hospital, Reliance Hospital, and we thought it would be a good idea to invite Dr. Abhishek Kini, who is one of the top names in foot and ankle reconstruction in Mumbai, and he is of course an orthopedic surgeon and also a specialist in sports medicine. I'll introduce Dr. Kini. Dr. Kini completed his MBBS and postgraduate training for DMB in Orthopedics and Traumatology at the Tejasvini Hospital in Mangalore. He further trained in the UK as a fellow in foot and ankle reconstruction. He underwent specialized training as a fellow in High Osteotomy. He trained in Germany and as a fellow in Foot and Ankle Arthroscopy at the University of Amsterdam in Holland. Dr. Kini holds memberships of the Indian Orthopedic Association, Indian Foot and Ankle Society, Indian Orthopedic Society, the AO Trauma India, and the AO Spine India. He is a faculty for Foot and Ankle Society and undertakes education activities around the country. He has authored 13 indexed publications and delivered several presentations at orthopedic conferences. Welcome to Health Live at Seniors today, Dr. Kini. How have you been?
Thank you very much. I've been good. Thank you. So it's actually my honor to be here. And I think it's important that we address, take care of our senior citizens equally as well. We take care of our young athletes.
Absolutely. And, you will be happy to know that all the people who attend this session, there are a few people who are under 60, but all of them are 60 plus. And, when we started out the health sessions, we were unsure whether we'll get questions on Zoom, people, keying in the questions, etc., on their phones or whatever. But you will be, pleasantly surprised to see that everybody is so active and they ask questions over here. And even on a specialized topic like foot and ankle, there will be a lot of questions. Without further ado, let's over to you, Dr. Kini, for the presentation. As Dr. Kini sets up his presentation, those of you who have questions, please put them in the Q&A tab and put in your name and gender and your age so that Dr. Kini's answer could be a little more considered. Over to you, Doctor.
Thank you. So I'll just share my screen. So as a foot and ankle surgeon, one is what the patient comes to me for. So we'll be talking about two different concepts. One is what they come to me, that's the presentation about. But I also feel as a foot and ankle surgeon, what's very, very important for senior citizens is how we can make a change. And the change is how to prevent falls. Because we know that falls in an urban lifestyle is the most important predictor for morbidity. See, mortality with a cardiac arrest, that we all know. Mortality means the patient is already heavenly abode. But morbidity, when the patient is bedbound for months or weeks or days, is where we can make a change. And that fall prevention is going to be extremely important with our elderly population increasing. Like in a city like Mumbai, where in an urban lifestyle, we hardly get any road traffic accidents as trauma. We get all patients who have fallen in their bathrooms, fallen down the stairs, fallen like on the uneven roads that we live on. And that's where I'm going to start my presentation by making correct footwear choices, followed by a small presentation on very common topics like heel pain and flat feet. If at any point of time, if any one of you all have questions, please just raise a hand and ask a question. I'll be happy to answer it. So as humans have evolved from four-legged monkeys to a double or dual leg primates, we have the foot function has also evolved from like a primary appendage to hold on to twigs to calf dependent balance and stability. And that's where we find that the foot and ankle plays a big role in human evolution. It's making us to walk on two legs. Footwear have also evolved from the padukas of like Ram Rajya to the stilettos and Oxford shoes of Ram Leela. That's the major change that we've seen in footwear. So what is the footwear function for? One, protection, like it protects us from external environment. Two, it adds to our stability of our feet and the body balance. Three, it also helps us overcome certain disabilities like people with foot drop or polio or flat feet. We can modify their feet, footwear to suit for their feet. Last, it also helps us in achieving our goals, like someone who's an adventure sport or wants to walk a marathon or something, we can get them customized shoes which will help you walk better or goals. So if most people come and ask me which is the best footwear, so there's nothing like ideal. So ideal thing depends on your foot type and your demand. So someone who has such a flat foot, like the top picture, will not be equally happy with a footwear that you give someone who's had a trauma in the below picture, like he's having bleeding on the underside of the ankle. So demand, like someone who's trekking in the Antarctic, as sir said, that needs a different thing. Someone who's a marathoner needs a different footwear, while ladies who walk the red carpet need a different type of footwear. So nothing is ideal. So let's discuss some common footwear, their pros and their cons, and depending on that, you can make a selection what works best depending on your feet. So most commonly what we see in our country is slippers. They are easiest to wear and buy, but they are dangerous because they don't have any support. They don't have any protection, like the upper part of the foot or the dorsum of the foot is open. They have zero stability and they are prone for ankle injuries, toe deformity, toes curling as with age, and also cause posterior problems. So if you ask me as a foot and ankle surgeon, I would say that's a strict no-no for slippers. The second type of chappal is slightly an elder brother of slippers. They are flip-flops or chappals. They are again comfortable, but can bring agony to the feet because they don't have any support or any protection. They are better with stability than the slippers, but again, they don't have any arch supports. Heel pain, twisting injuries are prone after wearing them. You can also slip and fall on the uneven roads and paver block footpaths that we have with them. A little better than these flip-flops are sandals or platforms and wedges for girls, for ladies. So they are comfortable and they are functional. They are better with support, especially with the heel strap coming around it. They give better protection. Again, there are no arch supports in these footwear. You can apply an arch support with an orthotic and insole in them. But again, the strap and everything on the back of the heel can cause problems. And the wedges with such limited support can cause twisting injuries to ladies. So again, they are a mix of both worlds, so not always functional. Coming next to leather shoes or Oxford shoes, they are the formal wear footwear that mostly men and corporate women wear. They are comfortable depending on the feet. They are much better with support. They give good protection to your feet, but no, they don't come to put an arch support. Sometimes it becomes little stuffy and can cause foot pain, can cause back of the heel pain because the heel counter comes over there, can cause foot cramping, toe pains because they are too tight from the top, and deformities can also cause mid-foot ache. So as the protection increases, the comfort decreases, and as the most comfortable footwear are not always protected. Next, best footwear, if you ask me today, is sports shoes or sneakers. They are comfortable to wear, activity wear, they are comfortable. They give a great mix of form and function. They have much better support. They can protect your foot from the front, top, back, sides, all the sides. They can be easily used with arch supports, that's orthotic, that can be customized for your feet. They can easy to accommodate by extra padding or modification for certain shoes. Next, certain high heels or stilettos, they are fashion wear. They are not always comfortable. They are aesthetic in a woman's feet, but they don't give much support, no protection, no arch support, and they come with a load of problems like shoe bites, bunions, like the toe curling inwards, twisting of ankle and posture problems in someone who is not used to these. So you have to use them with a lot of precautions. Nowadays, we have customized footwear. They are not aesthetic, but they are extremely functional. So an orthotic measures your foot and can get one customized for you, especially if you have certain disabilities like polio, nerve weaknesses, you have a flat foot or a high arch foot, which causes instability in frequent ankle twisting. Certain times post-fractures and post-traumas, the misshapen foot can be customized in them. So that helps you a lot. Demand with flat feet in a standing job, you can use them. Certain people who have height differences in two limbs can be easily accommodated with such customized footwear where you have things. Last but not the least, very important population, which we are the world leaders in, is diabetic feet. Those diabetic feet which need special precautions can have customized footwear, some things like this. So these are the broad outlines for customized footwear. Depending on what works for you, what doesn't work for you, one should select these footwear and go ahead. So before I go on to anything else, any questions which have come up? I guess none. Mr. Maheshwari, I'll just.
I'm sorry. We don't allow for questions in between the session. So
okay. So I'll just finish it and then we'll take it again.
That's right. That's
right. Fair. So next common topic that patients come and see me for is heel pain. So heel pain is very common, very commonly seen in our population, commonly misdiagnosed as plantar spurs, this and that. There's a lot of misinformation about them on like everywhere on the social media. So heel pain can be of two different types. One is infracalcaneum, that is below the heel, and one is retro, that is behind the heel. So infracalcaneal can be these complaints and the back of the heel can be these complaints. So let's go one by one on them. Most common thing after the x-rays that are done is you can see these spurs over here, and that's what your physician will tell you that, they are common heel spurs ho gaye aapko. But mind you, more than 50% of patients above the age of 50 will have these heel spurs, and these heel spurs are not pathologic. They are seen in like good number of individuals, and it originates at a muscle and not at any of the fascia or something. So talking about infracalcaneal heel pain, plantar fasciitis is the most commonest cause of heel pain. It's due to irritation of your plantar heel spurs, which are seen. So if you see, it's at the bottom of the heel. It comes over here, and that's where patients will point out a finger. It's common early morning on initiation of movement, that especially after a period of rest, when you start walking, that will get calf pain. It is associated with calf tightness, and on pressing, you will feel that where I just pointed out, you will have a kind of pain over there. So what is the most easiest way to treat it is physiotherapy or physical therapy, which involves lot of stretching. In our textbook, it's written to have military discipline, but in our country, I tell them you do it like in a very religious manner, as people do religious rituals every day, morning and evening. If you do these stretches that religiously, I think you will come out of it. In rare cases, you need night splints like the one that's put over here. You can use specialized soft cushion footwear, and rarely you may need some injections like corticosteroids, which are given over there, or a surgery, if indicated and done properly, can give you good results. Other causes of heel, like bottom of the foot heel pain, can be heel fat pad atrophy, again very common in elderly senior citizens. As you lose your fat content of the body, you get them. Calcaneal stress fractures, someone who's just had a fall coming downstairs, or tried to run a marathon or done some religious yatras like Pali Thana, Vaishnav Devi, they come back with calcaneal stress fractures. Rarely in this age group we get nerve impingements, which are classic of tingling sensations, and paresthesias like inflammatory causes like rheumatoid arthritis and all can cause this thing. Next common cause of heel pain is back of the heel pain. This is because of a pump or a bump of bone which is seen over here. That's and difficulty in wearing shoes. They're more common in like little elderly people who own or who've been in standing jobs for a long time. Again, initiation of movement is painful and you see a calcification in the X-ray. So treatment again goes in like physiotherapy, where you need to do a lot of stretching, where you stretch the calf adequately and try and wear soft heel or an open counter shoe with a small heel raise that doesn't allow the pressure to fall on the tendon and this thing. These patients do well with surgery when properly indicated. You need to remove the bump and reattach the calcaneal, reattach the tendon onto the calcaneum. We also do it at Reliance endoscopically. That's a keyhole surgery, like how you do laparoscopy. This is how it's done. Only 2 cuts are put over here and the remaining tendon and everything is bumped off from there. So once you know the 2 differentiation of heel pain, one is bottom of the heel and one is back of the heel, your approach to that problem becomes easier, and that allows you to kind of take things out of your system very easily. Last, but another very common topic that most senior citizens come to me for is flat feet. Again, commonly seen in our population because of the ligamentous or the flexibility or laxity that we have in our population. Commonly maltreated by people telling that there is no treatment for it and you just have to live with it with pain. There's nothing like that. There's a lot of misinformation again on this. So adult acquired flat feet is again, arch height is variable. Like you have a 5 feet gentleman and a 6 feet gentleman. Neither the 5 feet is a dwarf nor 6 feet is a giant. They are in the normal range. So arch height is something similar, is normal range. Low arch is not always pathologic, as there is a wide variation. Any flat feet that is abnormal loss of arch with pain is the cause, is a pathology. Pain causes pathology. And it's the endpoint of collapsed medial arch associated with deformities in hindfoot and forefoot. So hindfoot, the back of the foot moves outward, the front of the foot moves, it's turning inward. So it turns inwards over here and your foot goes flat like this. So it's the deformity happens in 3 dimensions, and that's what you need to identify and treat each and every deformity, each and every component of deformity correctly. So what does the patient come to us with? Pain on the inner side of the foot. That's where the important tendon of tibialis posterior comes and attaches. That causes degeneration and stretching and pain. The deformity, the arthritis causes the deformity, and impingement on the outer side of the foot, because the ankle bone digs into the heel bone, and that's what causes the pain. This another very common complaint that we find is post knee replacement patients. Now we have a large series of knee replacement patients where they're coming that they have done an expensive operation to walk and now are not able to walk because of their foot being flat or the foot causing pain than the knee now. So when you test them, they can't go on their tippy toes, and that's a very common sign. Whenever you ask for an X-ray, you need to ask for a standing X-ray so that you can identify the deformity, that how badly these things have kind of gone out of place. So the deformity is staged in 1, 2, 3, and 4. 1 normally doesn't need any intervention and needs only arch supports or customized arch supports and physiotherapy. 3 is where the pain is permanent, like the deformity is fixed and there is arthritis and you need to undergo a corrective fusion for those patients. Stage 2 is where we can actually make a difference by offering them something like a flat foot reconstruction. That's a reconstructive surgery where you normalize the arch of the foot and it allows you to function your foot normally with maintenance of all the movements. So stage 1, mostly if there is inflammation, we do an endoscopic or a keyhole surgery to repair the tendon. Stage 2 is where the flat foot, each and every component of the deformity is corrected. Like the ankle is straightened out, the heel is slided inwards, the tendon which is torn is advanced or added one more tendon with one more tendon lying adjacent to it, and the ligament which is stretched is repaired and resurfaced. So these multiple steps for each and every deformity is done. And finally, what we see is as the flat foot being reconstructed. So these are certain clinical pictures of them. And now you can see how this lady, which was flat-footed, now able to walk on her toes, and the arch is beautifully seen in this lady. So in stage 3 and 4, where there is arthritis, what we do is like selective fusion. That's what we have seen over here. And in stage 4, where there is ankle arthritis, nowadays, in olden times, we used to do a fusion, like by putting some rods and nails over here. Now we also have an ankle replacement like the knee, where you can do preserve the ankle range of movement by doing an ankle replacement. So a patient who comes to us like this can nicely be treated and give them a beautiful functional arch. And you saw the video of the patient walking. So we have a flat foot solution, and these patients need not be carrying on with pain all their life. Thank you.
Thank you very much, Dr. Kini, for a very detailed presentation. We have, just wait for your, you can stop your screen share so we can.
Sure.
Great. Excellent presentation, Doctor. We have a few questions that have come in. Can I take them now?
Yes, sure.
So this is from Katie Dadanchi. She says, Doctor, 10 years back, I met with a car accident and my navicular bone in the ankle got dislocated and fractured. A K-wire was put in place there. Till today, if I stand for more time, the ankle feels heavy and swells up with fluid, which lessens after I raise my ankle. Is there any remedy for this? Should we seniors give a break to Shellcal CT500 tablets taken daily and Uprise D360K capsules taken once a month? And for how long at a time?
Okay, I think there are two parts to the question. One is about his old injury. I think 10 years back, maybe K-wires was the norm. Nowadays, if someone has a foot fracture, we try and fix it and restore the anatomy. If sir is still having pain and swelling at the end of the day, that means that the fracture joint, but it joint little malunited and now has ended up in arthritis of that joint. And that's why he's getting pain and swelling. The best way is to do an X-ray and see what the current status is. And again, as I said, if there is a pain or significant disability, getting customized shoes may help him overcome that disability in the midfoot and help him walk better. If in spite of footwear, if his pain persists, then you can offer him a surgery where you can correct the deformity and give him permanent pain relief. So I think I'll be happy to see Mr. Karsi whenever he wants and offer him appropriate treatment.
Thank you. We have a question from Dr. Vidya Javheri. She says, can massage on feet help with the plantar fasciitis?
Okay, and I think massage on feet does help in plantar fasciitis. So massage is a form of exercise which allows you to stretch the tissue. As we discussed, plantar fasciitis is because of muscle tightness. And imagine if my sleeve is tight and if I stretch it, it's going to be stretched at points where it is attached and it's going to snap someday. So plantar fasciitis comes at this point where you kind of see that it joins at the heel bone. It starts at the heel bone and then goes on to the toes. Because the toes has 5 attachments and the heel bone has only 1 attachment, the bottom of the heel is where the inflammation starts. So if you massage that point where you are pain, that will help. Try massaging with an ice bottle or a golf ball so that they are hard substances. They can squeeze out all the tightness and all the inflammatory mediators, and that can help you walk better.
And the same person has asked question, is cardio contra indicated in plantar fasciitis?
Not necessary, but yes, any impact activities, like if you have an active plantar fasciitis, then avoid the treadmill, avoid running on hard surfaces like tarmac or concrete. If you want to do cardio in plantar fasciitis, try swimming, try cycling, try elliptical. if you're walking or running or jogging, then walk on natural surfaces like grass, ground, gravel, and sand.
Right. Thank you. We have a question from an anonymous attendee who asks, which sports shoes do you recommend? There are many companies in the market.
So again, I think the most commonly, I won't say I think the brands are many, but I think the type of shoe I would always want my patients to wear is something that is thick sole cushioned footwear, which does not bend easily. So you should have some sole which is thick. You can buy any brand. All the brands have it. Avoid those fashionable free flex shoes because they will load your feet a lot. So foot in an elderly patient needs comfort, cushioning. So make sure that your shoe sole has thick cushioned soles which don't bend easily. So that sole will give you added protection to walk better.
Right. Doctor, we have a question from Mr. Ajay Roy. Says, my wife is having calcification ankle, all treatment done, even shock therapy, but no results are there. Is there any surgery for it?
So, yes, we do endoscopic surgeries for ankle calcifications, like only a telescope goes in, like a telescope, how you do a laparoscopy, that arthroscopic calcification removal is done. In one of the videos that we just showed right now, that endoscopic bumpectomy was done. So that calcification from the ankle was removed and the patient could resume back to his tennis. He's a very avid tennis player at Wellington Gymkhana, and he said that at this age also I want to play tennis because that's the only thing that keeps me happy and meet my friends, and that's where we socialize. So I'm very happy that we could help him with a keyhole surgery, and he could walk or he could play tennis in 6 weeks' time.
Right. We have a question from Mr. Umesh Kuncharkar, who's aged 70 and he's a resident of Hubli. He says, I'm going every day for a morning walk of 4 to 5 kilometers and doing some yoga and free exercises, etc. The complete day I'm active and without any problem. I'm a diabetic for 20 years and take tablets regularly. The recent report of my sugar level is 120 by 230. I'm getting severe pain in my left ankle for more than 15 days. Consulted with an ortho doctor, and he prescribed tab surufina, 20 numbers, one in the morning and one in the evening for painkiller, and acidity tablets, 1 in the morning. I'm not getting any relief with these medicines, and neither can I walk freely, but I've kept my yoga regular for 1 hour in the morning. Doctor, can you please advise me the best possible treatment so that I get relief and continue my morning walk without any pain?
So I think two things. One, we have to diagnose the problem correctly. And second thing is to help them get a solution to it. So what I could understand is he's having foot pain without any significant trauma. So in a diabetic, the foot pain, one of the biggest red flags for us is there should not be any diabetic Charcot-neuroarthropathy, that is the peripheral neuropathy affecting the feet, and that's a nightmare for patients. So make sure that you get it checked properly again and find out that there is no neuropathic signs in your foot. Number two, the painkillers will be temporary. You need to find why the pain is coming. If it is a neuropathy pain, then you need nerve sootheners. Like there are many arthritis along with this. And there has been a flare-up of the arthritic, then you need rest, customized foot. So as we discussed, you can try getting customized diabetic footwear done for you in Hubli also. That also helps you much better to walk. So a combination, you need both correct diagnosis and appropriate treatment. So make sure that you discuss these points with your doctor, saying that this is what we heard about it going. Is it this or is it not this? And accordingly you can help.
Right. We have 2 more questions, doctor. One is from an anonymous attendee. Can you please help with floating toes? Is there some treatment for that? Several times that causes bad heel pain. What do you suggest?
So I think floating toes will not directly cause bad heel pain, but yes, floating toes can cause tight plantar fascias, and that can cause heel pain. So if the floating toe per se is not troubling and it's only the heel pain that is troubling, we need to start on physiotherapy, as we discussed in my presentation about, giving good plantar fascia stretches, and that will take care of it. If floating toes more often than not come to us because those floating toes are either crossed or having a deformity, and that causes difficulty in patients wearing footwear, then we correct the floating toes by a small toe surgery and align them in correct position so that they can start walking normally. Because in these age groups, that regular evening or morning walk is like their endorphin release point. It's very important that we get them their quality of life back. So again, these toe surgeries or these laparoscopic ankle surgeries are quite minimally invasive surgeries that we do, and they help patients get back to normal walking sooner.
Right. Doctor, there is a question from Mr. Suresh Ghate, who's 70. Says 6 years back, he underwent a tendo Achilles operation on his left leg. After that, my left leg and forefeet get swollen all the time. No pain, no diabetes. Please suggest a remedy. He says his left leg ankle gets swollen.
Correct. So I would say that's because when you had an Achilles rupture, not just the tendon, but along with that, its surrounding blood vessels and everything also get injured. Plus, the Achilles has got repaired. The structure has got its continuity back, but the function of the calf has not yet come back. So our feet bear the brunt of gravity. Gravity pulls the blood down, and calf is the peripheral heart which pumps the blood up. And especially when you had that muscle surgery done, what you need is good physiotherapy, even though 6 years old, but still I think that's not late. You should try doing good calf physiotherapy and it will improve. If the swelling is troubling you a lot, wear compression socks in the day. That will not let the swelling come up by the end of the day, and that will help you walk better.
Right, doctor, 2 more questions that have come in. One is from an anonymous attendee. What are the reasons for swollen feet? And yeah, that's one question. You can answer that.
So there are multiple reasons for swollen feet, right from medical and local. Medical or systemic, and local foot and ankle. So medical and local can be high blood pressure, kidney problems, urea, creatinine, diabetes, vascular like blood vessel channels and everything. So that is a complete different reason. Local reasons for foot and ankle can be local trauma, arthritis, muscle wasting. As in diabetic, again, we see a lot of peripheral neuropathy causing muscle wasting, and they cannot pump the blood up. So systemic and local are the 2 broad criteria, and there are many reasons in each one of these criteria. One needs a clinical examination to see what is wrong.
Right. One last question, doctor. This is from Aban Dondi. Does keep feeling cool in the base foot is only in my right foot. What could be the reason?
So the most common reasons for altered sensation in your foot, whether it's more likely in the bottom of the foot than the top of the foot, is peripheral neuropathy. If you're not a diabetic, then that's a good point. If you're diabetic, then that's going to be a long battle for you, where you may have to just take some pain or soothing relief. But normally these altered sensations will vary for a period. Over a period of time, they will die down and you will not feel any sensation. If you ask me, not feeling sensations in feet is much worse problem than having pain. If you don't have sensation, imagine you get pricked or you get cut on the foot, you will not realize that. So having pain is a good point. Make sure that you get it correctly diagnosed, like from a good neurologist or a good clinician, whether it is neuropathy or whether it is local or whether it is systemic, and accordingly treat it appropriately.
Thank you very much, Dr. Kini, for taking some quality time today, and all the questions you've answered very well. And we have one more question. Sorry, doctor, we've just come in.
Sure.
After this, no more questions. I know you have to leave.
No problem.
Why do feet tingle at times?
So I think tingling in feet is because of a nerve. So tingling basically is a nerve-related sign. So tingling can happen because of generalized peripheral neuropathy. It can happen because of spine nerve compression, where the nerve supplying the feet in the spine get compressed. Similarly, the nerves can compress anywhere from the spine up to the feet, like back of the knee, side of the knees, wherever in the ankle, in the inside of the ankle, wherever there is a compression of the nerve, tingling can come in. So one needs to again identify, clinically examine, and treat it appropriately.
Right. Thank you very much, Doctor, for your session today. You've answered quite a few questions already. And as always, we will be back next Saturday at 5 p.m. Those of you who would like to attend our sessions, you need to, as always, you can pre-register. And of course, you can also look at our announcements and register, but you can pre-register. We have a session on liver transplant by Dr. Chetan Kalal next Saturday at 5 p.m. So please be there. And thank you very much once again, Dr. Kini.
Yes.
Dr. Abhishek Kini, you've been, it was great to hear you on Foot and Ankle. And thank you to the team at the Sir H.N. Reliance Hospital for facilitating this. Thank you very much.
My pleasure. My pleasure.
Subscribe now and press the bell icon. Never miss an update.